There are currently about 16,000 people on the wait list for a liver transplant, but 15 to 20% of them will die because there are not livers available for them.
So liver preservation right now is just putting the liver basically in a box of ice. It allows us to transplant these pristine livers, but it doesn't let us transplant livers that are of a more marginal quality. Machine perfusion is a dynamic preservation method where we pump a nutrient and oxygen-rich solution through the organ. So rather than suppressing the liver's function, we're actually trying to support it and even recover some of the injury that it sustained during the preservation period.
What we do is statistical control of the organ. Look at what it is performing. Metabolic activity, oxygen uptake, basically, is it doing what it's supposed to do in the body or not? We can then compare this to a healthy organ or a diseased organ and say, this particular organ is good for transplantation or it will fail after transplantation.
So keeping the liver alive using organometrics and the predictive capabilities of organometrics will combined contribute to being able to use many more organs for transplantation, reducing waiting lists, and treating many more patients with end-stage liver disease.
We do about 6,000 transplants a year nationally, so potentially, 8 to 12,000 instead of 6. And that would certainly take care of death on the wait list.